Hello there. Welcome to our video on understanding and managing fevers in children. It's one of the most common concerns that parents face, and it's completely natural to feel a little anxious. I truly understand the worry and uncertainty that comes with seeing your child feeling unwell. But let's take a deep breath together and try to approach this calmly and rationally. Know that most fevers are body's way of fighting off infection. That's a good thing. It means their immune system is working as it should, defending against those pesky invaders. So what exactly is a fever? Let's break it down in simple terms. Simply put, it's a rise in body temperature, usually above 100.4 degrees Fahrenheit or 38 degrees Celsius. This is the threshold that doctors generally use to define a fever. For newborns, babies under 3 months, any fever is a big deal. Their immune systems are still developing, making them more vulnerable to serious infections. If your little one is that young and running a temperature, don't wait. They can get sick quickly. Call your doctor or go to hospital immediately. A doctor can quickly assess the situation and determine the best course of action. It's always better to err on the side of caution with such young infants. For babies 3 months and older, fevers are super common and usually not dangerous by themselves. As they grow, their immune systems become more robust. Most are caused by viruses like colds or even teething, and they'll run their course. These viral infections are often self-limiting, meaning they resolve on their own with rest and supportive care. What matters most is how your child is acting, not just the number on the thermometer. A happy, playful child with a fever is generally less concerning than a lethargic, unresponsive one with the same temperature. If your child is older, think toddler to teen, and they're drinking fluids, staying hydrated is crucial when they have a fever. If they are playing and interacting, even if it's not their usual energetic self, that's usually a good sign. It suggests they're still relatively comfortable and their body is managing the infection. However, if your child is unusually drowsy or difficult to wake, has persistent vomiting and cannot keep anything down, shows signs of trouble breathing or struggles with neck movement, particularly if it accompanies a rash that doesn't fade when pressed. All these symptoms may indicate a more severe infection or condition that requires immediate medical attention. Do not delay and seek emergency care right away. Additionally, if your child appears very unwell, experiences a seizure, or if a fever lasts longer than a week, contact your healthcare provider immediately. Prompt action can be life-saving in these situations. Trust your gut. If it doesn't feel right, get them checked. As a parent, you know your child best, so trust your instincts. Let's talk about keeping your child comfortable while their body fights off the infection. Dress them in light clothing. Avoid overdressing them, as this can trap heat and make them more uncomfortable. Offer plenty of fluids, water, diluted juice, or electrolyte solutions are all good options to prevent dehydration, and let them rest. Encourage them to get plenty of sleep, as this is when their body does most of its healing. Forget the cold baths or alcohol rubs. Those old tricks can actually do more harm than good. They can cause shivering, which can actually raise the body temperature, and alcohol can be absorbed through the skin, leading to toxicity. If your child seems really uncomfortable, you can use acetaminophen or ibuprofen. These medications can help reduce fever and relieve pain, but make sure you're following the right dose for their age and weight. Not sure? Ask your doctor or pharmacist. Dosage is crucial, and overdosing can be dangerous. Fever can feel scary, but it's often just a sign that your child's immune system is doing its job. It's a natural response to infection and usually resolves on its own. Watch for how they're acting, keep them comfortable, And don't hesitate to reach out to your healthcare provider if you're worried. Your doctor is your best resource for personalized medical advice. You've got this. And you're not alone. Remember, countless parents have navigated this before you. Thanks for watching, and take care of yourself too. Remember to prioritize your own well-being so you can continue to provide the best care for your family.